and welcome back to another episode of Team Up, a safe space where we discuss various topics concerning youth. Hi, I am Zainur Rashid.
And I'm Naufal Nukman, and I will be today's co-host. Today we are accompanied by our guest, Alia, who is a representative from Sport. She is the lead volunteer for operations and program at Sport, with a passion for empowering the young girls with financial stability.
Thank you, Mariam and Naufal. I am honored to join you guys today at Team Up to discuss topics that are important for the youth to go through puberty with dignity. For those of you who are listening, I hope this discussion will be beneficial for you.
The topic we're discussing today is all about sexual health. Since sexual health is a broad term, we will be looking at several subject matters relating to the topic.
Okay, so a big part of understanding sexual health is of course in defining the functionalities of the human sexual organs. So therefore, I'm going to pass to our guest today, Alia, to continue about this topic.
Thank you, Naufal. So, I'm going to start this topic by explaining how the female reproductive system works. Basically, the female reproductive system provides several functions. The ovaries produce egg cells, also called as the ova or ovum. So the ova are then transported to the fallopian tube where fertilization by a sperm may occur. The fertilized egg then moves to the reproductive cycle. Once in the uterus, the fertilized eggs can implant into thickened uterus where the uterine lining has thickened in response to the normal hormones of the lining and continue to develop. If implantation does not take place, the uterine lining is shed as menstrual flow, and in addition, the female reproductive system produces female sex hormones that maintains the reproductive cycle.
It's very interesting indeed. And what about the male reproductive organ? Because as a male, I should have some level of knowledge about this.
Of course. Well, male on the other hand have the purpose of producing, maintaining and transporting sperm, which are the male reproductive cells. These sperms have a protective fluid around them called semen. The function of a male reproductive organ is to discharge sperm within the female reproductive tract during intercourse. Their sexual organs is responsible for producing and secreting male sex hormones responsible for maintaining the overall male reproductive system.
Okay, so now that we've cleared the ground on that, a bigger issue among the umbrella of preserving sexual health is the existence of HPV, which is short for human papilloma virus. Alia, can you tell us more on that?
Okay. So HPV, are also known as the human papilloma virus, is only one of the numerous sexually transmitted infections in the adult population. It may present itself as unsightly genital warts, sort of fleshy grape-like lesions. The infection of the cervix in women can lead to a fairly common cervical cancer later in life. HPV is a virus which infects the male genital tract and also cervix lining of the female genital tract. There are many types of virus, including the more common types, which are type 6 and 11 that can cause genital warts, and also type 16 and type 18 infection that is responsible for 70% of cervical cancer that is caused by HPV.
Oh, so we know that treatment exists for this disease in the form of a vaccine, which is basically a preventive measure. So what exactly is the vaccine and how is it administered into the body?
So the vaccine is made using a single protein from each of the 4 severe types of HPV. This vaccine is given at late childhood with the aim of preventing cervical cancer in adult life. It is given by injection into the shoulder muscle in older children, with the first dose to be given from 13 to 18 years old. Second dose is 2 months later, and the third dose is 6 months after the first dose. So in Malaysia, the government provides HPV injections for girls ages 13 years old, which is free in schools.
Oh, that was a great information, Alia. So, when we ask the question on who should receive the vaccine, of course, parents can decide whether to subject their healthy adolescent daughter to the vaccination. As such, there are many ethical and moral issues involved, especially since there are existing behavioral ways of preventing the spread of HPV.
And speaking of HPV vaccines, it sort of begs the question: are human papillomavirus or, of course, HPV vaccines actually safe?
Yes, it is safe and effective. The only thing you might experience are some common side effects, which includes pain, redness, or swelling in the arm where the shot was given. It is normal for every injection. Other than that, you might also experience fever, headache, or you will feel tired, nauseous, or even muscle and joint pain. You should take note, however, that when we receive the vaccine, in order to prevent fainting and related injuries, you should sit or lie down during the vaccination and remain seated for at least 15 minutes after the injection.
Uh-huh. So, a simple question. Let's say if I take the HPV vaccine, how long will it protect me from the HPV infection?
Studies have shown that HPV vaccine does provide good protection for at least 8 years. So furthermore, your antibody level will be much higher after the vaccination compared to the antibody level after the real infection. So the vaccine is most effective when it's given at a younger age and before sexual intercourse.
The viewers should also understand that the HPV vaccination is by all means not an indirect promotion for you to become involved in an early sexual activity. HPV vaccination is all about preventing cervical cancer, and HPV vaccination is not about promoting sex at all. Also, the UK and Ireland introduced HPV vaccination for boys aged from 12 and 13 as part of their national immunization plan in 2019, and Portugal introduced universal HPV vaccination for boys aged 10 years old and above as part of its national immunization plan in 2020. So there is up and coming protection for both in a sense.
Mhm. How about if a person is already pregnant? Should they receive the HPV vaccine?
Absolutely not. The HPV vaccine is not recommended for use in pregnancy. However, if you happen to receive the HPV vaccine whilst getting pregnant, it is important to note that the vaccine has not been shown to cause any harm to the body.
Okay, so as our final issue, I'd also like to bring in the topic of teen pregnancy into our discussion, as we know this is a big problem in our country. So Alia, can you tell us more about the seriousness of the issue and some of the effect it has brought on our female youth?
Okay, I like this topic. So, we know that Malaysia's social acceptance of teenage pregnancy is still poor, restricted, and secluded. It is regarded as a taboo, as premarital sex, incest, rape, sexual abuse, and teen marriage come as a precursor. This has caused pregnant teens to take drastic measures such as unsafe abortions and baby dumping. This is why we believe that we need to take time to educate ourselves regarding unwanted pregnancies and learn what measures can we take to fight this issue. Some of the facts that surround teenage pregnancies in Malaysia is that on average, 18,000 girls in Malaysia get pregnant each year, and these are teens ages 13 to 19 years old. About 4,500 cases involve pregnancy out of wedlock, and to put that in ratio, 14 in every 1,000 underage girls get pregnant every year.
Oh wow, I didn't know that. It's a great information. So while we're on this topic, could you please explain more on the signs and symptoms of teenage pregnancy for mothers out there who are curious about their child as well as the teenagers themselves?
Alright, so signs and symptoms of teenage pregnancy can be similar to pregnancy symptoms in women of other age groups. So missing the menstrual period can be the initial signs of pregnancy. However, teenage girls can have missed periods and irregular periods due to different reasons. Among other signs that teenage girls might experience is light bleeding from their private part due to implantation of a fertilized ovum into the uterine wall. And then also changes to the chest area due to the hormonal changes. And they might also experience fatigue caused by increased progesterone hormone, occasional headaches due to rising hormone levels, and also morning sickness, namely nausea and vomiting. Although it is called morning sickness, it may occur at any time. Sometimes, pregnancies have lighter symptoms such as feeling bloated and uncomfortable. Everyone's bodies are different, and these are the common symptoms, but the best way to know is to get tested.
And of course, I should also address that they might experience frequent urination due to the increase in the human chorionic gonadotropins, which is also known as the HCG hormones, which leads to increased blood flow to the pelvic regions in the initial weeks of pregnancy, and due to the pressure on the urinary bladder from the growing womb during the later trimesters. And of course, other than that is the common food aversions and cravings, as well as mood swings.
So to teens out there, if you are experiencing any of the symptoms, you might want to get yourself checked. Make sure to be responsible enough to get yourself checked and not be ashamed of the ordeal, as this decision will be crucial for your well-being and future.
And that's why it's really important for us to bring education to our youth, such as our efforts today to make this podcast in hopes that it might shed some light on this taboo issue. With that, our session has come to an end, and we thank you, of course, our viewers, for spending your time to listen to our podcast.
Okay, so before we end, let's take a look at what these people's idea regarding sexual health.
From what I understand, is about kita punya are we free of diseases semua lah. So I think that person yang they're very active should get checked regularly, especially when they exposing themselves to a lot of people, supaya ingatlah untuk kebaikan diri sendiri dengan kebaikan orang lain. And it's very important for people yang nak get married also to know about their partner punya kesihatan.
Okay, so learning about sexual health will help us to be more aware about issues that related to it. Okay?
Not forgetting our guest who has participated in the podcast session today. Thank you so much, Alia. It is a pleasure for us to have you here with us the whole time. We really hope we can collaborate more in the future, and to everyone out there, please stay safe and think properly before you guys make any decision, so you will not be regretting later on.
Thank you once again, Mariam and Alpha, for having me here today. If you have any questions regarding sexual and reproductive health rights, please feel free to ask us via Spotline at 018-240-4033. We have a panel of experts who will assist you with your burning questions.
Thank you for tuning in, and hope you all had a great day. And do not forget to stay safe and maintain safe distance in this pandemic. That is all, and thank you from us, team. Till next time. Goodbye.
Bye.